An estimated 10% of emergency service workers suffer from post-traumatic stress disorder, or PTSD. Given the frequent exposure to trauma, their treatment is challenging, which is why Employers Mutual provided funding for the Black Dog Institute and the University of New South Wales to develop best practice guidelines for the diagnosis and treatment of PTSD in emergency service workers. The launch of the guidelines saw the Honourable Prue Goward MP, Minister for Mental Health, speak on the topic of PTSD.
Governments never could and never will be able to solve these problems alone. So I think these guidelines demonstrate the power of evidence-based approach and expert collaboration, and I'm confident that they will help wonderful emergency workers to stay well and continue the extraordinary work and the giving that they do.
Rachel Elms from Employers Mutual.
Employers Mutual handle about 8,000 claims from emergency service personnel each year. Of the 8,000 claims that we handle, approximately 15% relate to psychological injury, including post-traumatic stress disorder. They're exposed to repeated trauma from seeing events and witnessing incidents that no normal human being would ever want to see.
Helen Christensen is the director of the Black Dog Institute and manages the science and strategy of the organisation.
We know that there are around about 80,000 people who work either in the police, ambulance, or who are firemen and firewomen who are exposed to trauma quite frequently and repeatedly, and approximately 10% may have post-traumatic stress disorder. It's just important that it's not seen as health treatment alone, but it's seen as how to keep people in work.
The 54 recommendations included in the report build upon previous literature in the field of PTSD. They incorporate the most current evidence-based approaches and are tailored to the emergency services industry. Dr. Sam Harvey is an associate professor at the University of New South Wales and led the team of industry experts that authored the guidelines.
What I hope they suggest is, firstly, that they suggest that PTSD is a treatable condition, that the idea that PTSD signals the end of an emergency worker's career is not right, that we've got a range of different treatments that now have a good evidence base and that we know are effective in a good number of emergency workers suffering from PTSD.
Returning to work is the first step to recovery for emergency service workers. Declan Collins from Employers Mutual.
Emergency services will be using these guidelines to provide a much more consistent approach in dealing with their workers who are suffering from PTSD.
I'm very excited about the whole approach. Knowing the job of an emergency service worker, we come across unique experiences, and to have a unique guidelines into treating what many emergency service workers suffer.
The Police Association of New South Wales welcomed the guidelines today, and we're absolutely ecstatic about it. Look, 16,500 members have been crying out for this, and we welcome the EML actually funding this.
That critical importance of early, appropriate and accurate diagnosis, and then the guidelines for treatment that really maximise the opportunity for people to stay in the workplace, keep contributing to the communities that they serve.
You can read the full report at the Black Dog Institute website or contact Employers Mutual for more information.